Hello, future doctors. How are you all? Welcome back to MedSteps ECG Series by Dr. Anand. So far, we have learned ECG basics, P wave and PR interval, QRS complex, ST segment, and T wave, and ECG paper basics and heart rate calculation. So today, we are going to learn one of the most commonly tested ECG topics in MBBS, FMGE, NEET PG, and USMLE examination. So the topic is cardiac access. So many students think cardiac access is difficult, but after today's lecture, you will be able to determine the cardiac access in less than 10 seconds. So without time waste, let's begin. So you can see here what is cardiac axis. First, we have to understand the thing. The cardiac axis is the overall direction of ventricular depolarization in the frontal plane. So, in simple words, the cardiac axis tells us the direction in which the electrical impulse travels through the ventricles. Think of it an arrow showing the main direction of electricity during ventricular depolarization. In simple analogy, imagine just imagine four people standing around a football field. So one person watches from the left. So you can see here, this is the one person watching left and one from the right. This guy. Okay. So one from above and one from below. So each person sees the ball from a different angles. Similarly, ECG leads look at the heart from different directions. The cardiac axis tells us which direction the electrical impulse is moving. Okay, so that is the main thing. So next you can see here what is cardiac axis. Why is cardiac axis is important? So yeah, knowing the cardiac axis helps to diagnose these problems. One is left ventricular hypertrophy and right ventricular hypertrophy and bundle branch blocks and fascicular blocks and pulmonary embolism, and you can see here some congenital heart diseases. So what is the normal cardiac axis? We can see here means in normal x-ray, in normal QRH axis lies between minus um, 30 degrees to positive 19 degrees, 90 degrees. So some textbooks uses minus 30 degrees to plus 100 degrees also, but for exams remember always normal axis will be like minus 30 degrees to plus 90 degrees. So we have one easy memory trick you can see here, that is, you can see this sphere. Think of the axis as a clock. So left side you can see minus 30 degrees, that is left side. In straight down you can see plus 90 degrees, so that is anything between these values are normal. Okay, so which leads helps to determine the axis deviation. So the in leads we can see it will help to determine the axis. The two most important leads we have in for checking axis deviation, that is and lead 1 and lead AVF. Okay, so the two most important leads are, that is lead 1 it will be like positive and lead AVF is positive. Okay, so these two leads are enough to determine the axis quickly. Okay, so this positive and negative QRS complex, we have to look at the QRS complex. If the R wave is larger than S, if you can see here, yeah, you can see here, so we can see the positive and negative. So if the R wave is larger than S wave, then the QRS is positive. You can see here. If the S wave is larger than the R wave, then it's become negative. Okay, so we have to always compare with R and S. So in normal axis we have to we can easily diagnose with lead 1 and lead AVF. So the axis is normal cardiac axis. So this is the most common finding in healthy individuals. So we have simple memory trick. So lead 1 will be like positive and lead AVF will be positive, means that is normal axis deviation. So always remember positive means perfectly normal. So why is the axis normally downwards and left? So the left ventricle is much larger than um, the right ventricle. So therefore most electrical activity travels downwards. So most electrical activity will travels downwards and slightly to the left. So this creates the normal cardiac axis. For example, you can see here a 35 years old healthy man has an ECG. So in the lead 1 shows positive QRS. The lead AVS shows positive QRS. Okay, so the diagnosis will be like normal cardiac axis. So in quick axis method, we have to ask only two questions. Whenever you are seeing any ECG interpretation, you have to ask two questions yourself. Is lead 1 is positive or negative? Is lead AVF positive or negative? If both answer is positive, then it's normal axis. This is the fastest bedside method we can follow for interpreting ECG. So we have some clinical importance for normal axis deviation. Most healthy adults have a normal cardiac axis. If the axis shifts too far to the left or right, it may indicate heart disease. In the next two lessons, we will discuss about left axis deviation and right axis deviation. Okay, so in systemic ECG approach, how to follow this thing means first we have to calculate the heart rate, then after we have to check the heart rhythm, then we have to look at the P wave and we have to measure the PR interval, then after we have to measure the QRS duration, then after we have to determine the cardiac axis and we have to assess the ST segment and T waves. Okay, so these are the things. So in normal cardiac axis means we have to remember minus 30 degrees to positive like plus 90 degrees. Okay, it will be like this. So lead 1 and lead AVF is positive, then we have to suspect patient have normal axis deviation. Good, congratulations. So today you learn how to identify the normal cardiac axis using the simple lead 1 and lead AVF method. So in day 11, we will learn about left axis deviation, including its causes, ECG findings, and important clinical conditions. So see you in our next ECG lessons on MedSteps by Dr. Anand. So till the time, take care. Bye bye.